So here we are at the absolutely gorgeous St. Regis Hotel in Abu Dhabi, United Arab Emirates. This hotel is right on what's called the Corniche, which is the road that rides right along the gorgeous landscape beach. And on each side of that road, one side is beach and one side is hotels and high-end shops and really beautifully done buildings as well as landscaping. So here we are enjoying this incredible place full of the customary gilt and beauty and aesthetic that we enjoy here in Abu Dhabi. It is amazing for sure. Today I was thinking about the fact that those of us who treat children, and as a pediatric dentist, and I know a lot of you treat a lot of children, and I'm thinking about the fact that there's a train approaching on the tracks of our practice, our lives, what's going on in our lives. There's a fast train approaching. And my question to you is, are you dancing on the tracks? Because we really need to be aware of the risk. Let me tell you what I'm thinking about. First of all, in pediatric dentistry or the care of the child patient today, it has become very fashionable, de rigueur, trend-setting, popular, all the rage, to actually avoid techniques that bother anybody. Not to bother the child, not to bother the parent. We want to make it easy for them, which is interesting because what happens then is that it takes us away from the customary, conventional, restorative kinds of thinking, reducing the risk of the child into an area of patching, covering, ignoring, and so forth. Which one of us doesn't want to do things easily for a child? We went into treating children, we care to treat children because we enjoy the child. And the parent appreciates that we're loving to them and everything is wonderful, assuming it works well. The problem is these new techniques are literally ignoring the bacterial etiology of dental diseases, both soft tissue and hard tissue. And in ignoring those, it's nice because when the child says they don't want, here in Arabia they say ma bati, that means I don't want. At home they say no, or mom, or something like that. When they say they don't want, what happens is the person treating them now has an option to say, oh, no, it's no big deal. We can just do this, and we don't even have to do numbing, and we don't have to do anything with the handpiece, and we can just proceed without any interruption in your life at all. Well, which one of us hasn't heard the parent say, Johnny, do you want your teeth filled today? Johnny, do you want your tooth pulled out today? Or whatever they say. And what does Johnny say? Ma petit, I don't want. What child wouldn't say no? What adult wouldn't say no? Certain things, if we don't have to do them, we don't want to do them. That's normal. So, okay, here we are with all these treatment plans that are becoming more acceptable to parents and child, ignoring the etiology of dental disease. And hear me well, why are we doing this? I think mostly to keep everyone happy. We are pleasers. We are approval addicts. We love taking care of people. We went into this to take care of people. And in our mind, we've gotten confused that if they're happy with us, then we're doing a good job. And sometimes it takes a lot more courage to say, this is what your child needs. This is what's going to do better for your child. Then, oh, everything is wonderful, and we'll just talk about diet control and maybe doing some chemotherapeutic agents, including fluoride, including MI paste, including things that will help reduce the risk. That's great. However, is it great? I ask you, doctor, how many of the parents for whom you've taught these techniques actually go home and stick to it? How many parents change the diet of their child? Really? I haven't seen many at all. Why? Because the child wants something different. Because he doesn't eat that. Because he doesn't like vegetables. Because he doesn't want whatever. Dietary counseling costs you money. It's a great idea. I remember back in the 70s and 80s, Dr. Walter Doyle, who used to actually have a microscope under which the child and parent could look at the little bacteria floating around, swimming around from their own plaque, hoping that that would give them what it took to reduce that plaque through good brushing and flossing. He did dietary counseling. He did fluorides. He did all of these things and incorporated it in his treatment. We can do that, but how's it working for you, doctor? How's it working for you? That's really the question. I don't even know how to tell you that in my mind is probably not a great use of your cost, whether it's paying staff or yourself time-wise to do it. Great way to spend your time. A great way to get your patients on board. I don't think that it has a real good chance of working well. But how about this? Boy, wouldn't the insurance companies love to say, they already don't pay for dietary counseling. They certainly don't pay for most of these chemotherapeutic agents. They might still pay for fluorides here and there. Wouldn't they love to say, you know what? We're only going to pay a very limited amount, and you can do, for example, the Hall technique, which is stainless steel crown over decay. And we'll pay for that, at least for now. The train's coming down the tracks. It's rumbling. And when I explained this to an attorney in our family, he said to me, I'd like to put my hand out and shake the hand of Dr. Hall, whoever he is, because it's just a matter of time before it makes a great living for all of us. Well, whether it's true or not, how's it working for you? That's the real question. Again, we have to remember our nature to try to please people, to try to make it better for people. That means even, you know what we do? We don't charge for things. Well, that's good because the insurance companies aren't going to be paying for much of it. Think about that. The less invasive treatments, the things that don't take much of your time, are going to be reimbursed at a very low rate. And are they really worth being reimbursed at a higher rate anyway? Maybe not. The train's carrying other cargo as well. Let me tell you about some of the other cargo. Let's think about Big Pharma continuing to develop chemotherapeutic agents, which will help you to supposedly prevent some of these diseases. Yes, if it's used. Let me tell you that think about the risk of what's happening with the insurance companies. Again, looking at all these procedures and deciding what they'll cover and what they won't cover. Medicaid, how much they'll cover. It's constantly being reduced, constantly. Think about the corporate dental centers full of young, just out of school graduates who are desperate to make a living because they have huge debts. They're doing what they're told. And what they're told is you can do these lesser time-consuming and cost types of procedures, even though you get reimbursed less, because we, the big corporation, can still make a very good living on the quantity, doing lots of it. Even the ADA is developing codes for these procedures. And it might seem to you that that's to help us and the patients. No. Does that help us and the patients? It allows the insurance companies one more foothold. That's what's happening. The train's rumbling. You know, we're responsible for all of this. We are responsible for what we do for a patient. We are responsible for taking good care of a patient. The best treatment for the patient is still your responsibility and my responsibility. And the parent expects us to, even though they might want us to do something minimally invasive. So here's the thing I'm saying. When I thought about all of this, what came to mind is that Johnny Cash song, and I'm going to tell you the words because it's so appropriate for the concept of what may be going on in our very caregiving industry practice for our child patients. I hear a train a-coming. It's coming down the tracks, and I ain't seen the sunshine since I don't know when. That train keeps rolling. I bet there's rich folk eating from a fancy dining car. They're probably drinking coffee and smoking big cigars. Well, I know I had it coming. I know I can't be free. But those people keep a moving, and that's what tortures me. Doctor, are you dancing on the tracks? Dr. Chris, signing off.